So I've been working at WHO for 9 years now. I'm a part of the secretariat that is working on the WHO model list of essential in vitro diagnostics. So why did we decide to develop an EDL, and why now? You must know that WHO has developed a list of essential medicines more than 40 years ago. This list of medicines is actually one of the most valued products from WHO. We believe that an EDL has a similar potential. So also, and I think this was already mentioned during the introduction just before me, it's clear now that the crucial role of IVDs is becoming widely acknowledged, and it is growing rapidly. The field of diagnostics itself is quite fragmented. So because of this, countries will need guidance for selection, procurement, and usage decisions. And we also found that during our initial discussions on the EDL, that there's a very strong support from the global health community for an EDL. So if you ask me why it's only 40 years late, after 40 years after the EML that you are working on the list of diagnostics, well, I think one of the reasons is that there was maybe so much appreciation of the critical role of diagnostics. Even at WHO, I think I've seen a big change during the past several years, where now everybody in WHO is also talking about the diagnostics. So there's really a strong awareness now about the roles of diagnostics. So these are, and this is a list of organizations that wrote letters of support to develop an EDL. So you can see that there have been many organizations. Even the diagnostic industry has been supportive of the EDL. So these slides give you some example of the benefits that will come with an EDL. Well, I think the most obvious one is that it will help countries to better prioritize their laboratory testing and infrastructure needs. The EDL will also help countries to improve outbreak preparedness simply by increasing laboratory capacity. The EDL will also facilitate the development of new diagnostics through identification of priority needs, and this will inform IVD developers, industry, and also there's a strong link with the EML in the sense that availability of diagnostics resulting from the EDL will also ensure safe and rational use of medicines for the EMLs. And finally, the EDL will also help increase affordability by facilitating bulk and advanced purchasing. Actually, also on this point, we had some discussion, for example, with India, and India told us that they will use the EDL to help limit the prices of diagnostics in India. This will be for the diagnostics on the list. So you can see that there will be an impact on the cost of the diagnostics. So this slide shows the initial steps that we took to develop an EDL. Well, we started to work on an EDL in late 2016, and we developed a proposal. A proposal was submitted to a WHO expert committee that oversees the EML actually, and this committee recommended in March 2017 the development of an EDL. So for us it was important because this gave us the green light to start developing an EDL. So, so from March 2017 to April 2018, we developed the first edition of the EDL. So, and also during that time, we also created a new committee called the Strategic Advisory Group of Experts, so it's spelled SAGE, for IVDs, for in vitro diagnostics. So this SAGE IVD committee provides an oversight on the scope, on the prioritization, on the inclusion criteria, and the process for developing the list. This committee had its first meeting from the 16th to the 20th of April 2018. And the main task of that committee was to come up with the first edition of the EDL. The first edition of the EDL focuses on high priority infectious diseases for a number of specialized tests for TB, malaria, HIV, hepatitis B and C, HPV, and syphilis. And in that first edition, we also have many general laboratory tests, such as creatinine and glucose, for example. It's important to note that the list is not about brands, it's about categories of tests. So why did we focus on these high priority infectious diseases first? Well, the reason is fairly simple, is that for these diseases, we have a lot of evidence, a lot of data on the clinical relevance of these other tests for these diseases. We also have strong programs. So for us, these were like low-hanging fruits for developing the first edition of the EDL. But it's clear that we need to expand much beyond that. So for the future edition of the EDL, we are going to expand to other infectious diseases as well as NCDs. And you will see that we plan to include NTDs actually for the next edition of the list. So the list will be reviewed annually, and it will be expanded annually. And the process is generally similar to what we use for the EML, but adapted to diagnostics. So these are the general principles for inclusion of IVDs in the list. Well, first, you need to show that they have public health relevance. We need to have information that is evidence-based. And also, the list needs to be free of conflict of interest. So these are the three main principles. As I said before, the process is generally similar to the EML, but adapted to the IVDs. And it's adapted because we know that often for diagnostics, we have low level of evidence available in developing countries. And also IVDs characteristics vary based on the level of the healthcare facilities. To come back to this issue of low level evidence available, I think we realize that often for NTDs, this would be a challenge. There may not be many studies that shows the clinical relevance, the clinical utility of a test in developing countries. So we will have I guess we will take this into account when we consider those tests for the list. And if there's not enough evidence from the literature, we may have to use expert opinions instead. So the priority diseases area for considerations for the second edition of the EDLs are diagnostics for emergency and outbreaks, diagnostics linked to AMR, diagnostics for NCDs, so non-communicable diseases, and diagnostics for NTDs. So we will encourage you to submit applications for the second edition of the EDL. So what does an EDL look like? Well, the first edition of the list, which was published on the 15th of May of this year, includes more than 100 tests. Approximately half of the tests are for specialized tests like HIV, TB, malaria, and so on. And the second half is actually more general laboratory tests. Tests in the list are separated to show which tests can be used in primary care settings where minimal or no labs are available. The second grouping is for tests that require lab supports. So we have, I guess, a two-tier system in our list. For each test, a link is provided to any pre-qualified products, if available, as well as any relevant WHO supporting documents, like guidelines, for example. And we are also in the process of creating a dedicated WHO page to centralize all available information that will help support the implementation of the list. And we are doing that because it's very clear for us that the list itself is not enough. You need to have a lot of things around the list to allow countries to implement it. So we are trying to help countries access this information. So this is an example of one page of the list, just to show you how it is currently organized. So the column on the most left is on the disease. Then we have the column that says diagnostic test, which is really the analyte that is being detected. Then we have the test purpose. Then we have the assay format. Then we have the specimen type. Then we have links to any pre-qualified or endorsed products. I do realize that in the case of ISNTDs, I don't think we have any pre-qualified products. And also the last column is WHO supporting documents, which is mostly the guidelines. So here, what we tell the countries is that they need to adopt and adapt the list to their own specific local conditions. So the countries need to consider a variety of factors to adapt the list. For example, some of the factors are the local demographics, the pattern of disease, the treatment facilities available, the training and experience of available personnel, local testing gaps, supply chain, quality assurance capacity, and so on. So we are going to compile information on all those factors. So we will compile information on the WHO website on all those factors to help countries find the appropriate information. So the list, as I said, has been published in May. It has been very well received. There has been many journal articles, many editorial in support of the list. So I think we have been very happy and a little bit surprised by the level of support that we have seen. So this is the timelines and the next steps. Well, so in April 2018, so we had our first SAGE IVD meetings, which led to the creation of the first edition of the EDL, which was announced on the 15th of May. In early July, so very soon, next week or the week after, we will announce a new call for pre-submission of applications to include diagnostics for the second EDL, for the second edition of the EDL. Here, we will be requesting only pre-submissions, and these are submissions that will include only information on the applicants, information on the on the burden of disease, for example. Now, what will this test be used for? What are the needs? And also we will require a description of the test. This information will be provided, will be forwarded to the relevant department in WHO. So in this case, this would be the NTD and maybe also TDR. And they will help us decide if really the application that you are submitting fill a need and is also meets the programmatic priorities of the relevant document, the relevant department at WHO. So there you will have 2 months to prepare such a pre-submission. The deadline will be the end of August. Then we will be reviewing that. As I said, forward this application to the relevant department. On this, if the relevant department thinks yes, this is something that we need, then you will be invited to submit the remaining of the applications, which focuses more on the collection of evidence that supports the clinical relevance, the clinical utility of the test. And for that, so the deadline will be mid-November, and the full application will be then forwarded to the SAGE IVD committee and to a couple of external reviewers if needed. So there will be a review of your application, and then this application will be considered at the SAGE IVD meeting in March 2019. And then if the SAGE IVD committee said yes, we need to include the IVDs from that list in the next editions, it will be included in the second edition that will be announced during WHA in 2019. So the World Health Assembly in 2019. So I think I'm almost done with my presentation. So it's clear that the EDL is only a list until it is adopted by countries to support access to in vitro diagnostic testings. So because of that, for us, this is very important, and this is something that came very clearly with the discussions that we have. The countries really need to adopt the list and to adapt to their needs. So the list itself also includes what we call a preface, and which is a document that describes what is needed around the list to allow countries to implement it. Okay. So I think I will stop here. You will see that on this slide you have my contact information. So feel free to contact me. I can provide you more details. There's also the link to the website where you can find the current list and where you will find the call for application. The call for application will also be forwarded to all the relevant networks, so I will also forward it to you. And I think that's all. So I will. Oh yes, I will also. I also send the slides to Marianne. So Marianne will be able to share the slide with you. So and I will be happy to answer any question if we have time. That's all.
Thank you very much, Francis, for that. It's Cameron here. Thank you. It's a round of applause. You made some major points there in terms of impact to innovation, funding, and healthcare systems from a country level. Could you take a couple of questions from the floor? If we could just open up to the floor.
Yes, thank you very much for this interesting presentation. I think it's good to have this list available. I was wondering about the information that you need. For example, is information needed on GMP production of the tests, and does it need a CE marking or not?
No, the diagnostics do not require to have CE mark or FDA approval or something like that, but they need to be commercially available because Yeah, the list is really for products that are on the market. So this is not a list to really. We are not going to list technologies that are in development. So the yeah but it will help if the product has CE mark or US FDA approval, for example. But it will help, but it's not required. Well, we had that discussion before. We are discussing about creating a wish list of diagnostics, but we are not working on that right now. But this is something that we might consider doing. But I think it's important. But this wish list will not be on the EDL. It will be a list beside the EDL. But I think yes, it's something that is important. Yeah, and I think well, and it's totally justified because the needs are very important for entities. But that list will also help, highlight needs, and we can use our Sage IVD committee for that too. So, we had that discussion during the meeting of the committee, but what to do with those diagnostics that are really needed, but there are no commercial products. So this is why we said yes, we should probably also develop a list beside the EDL to describe for this wish list. Yeah.
Thank you very much, Francis.
Thank you.
Thank you so much for your time.